On today's episode, I talk all about vaccine side effects. What about the causes of sudden blindness in a dog? I discuss the silent impact of kidney and liver problems and how they can be so well treated. I then answer, is it okay for a dog to sleep with you under the duvet? And then finally, what can be done for a cat who is sneezing, has a runny nose and eye discharge? But first, let's cue the intro.
You're listening to the Dr. Alex Answers podcast, the show that answers all of your dog and cat health questions so they can live healthier, happier lives. And here's your host, veterinarian Dr. Alex Avery.
Hi, and welcome to episode number 7 of the Dr. Alex Answers show. I'm Dr. Alex, the veterinarian behind ourpetshealth.com, and I'm so grateful that you're here sharing your valuable time with me. If we're meeting for the first time, then this is the show where I answer all of your dog and cat health questions. Be sure to subscribe so you don't miss out on any future episodes, and you can also get your question answered just by heading over to dralexanswers.com. So let's jump into the first question, and that was sent in by an owner whose dog had got his vaccination a day previously, and he was shaking. He wasn't very well, and wondering is that normal? Is that something that can be expected? Well, let's start off with thinking what vaccines actually do. So they're essentially a way of tricking the body into thinking that it is suffering from an infection so that it can then eliminate a true infection at the very early stages when it's just starting, before it can then start to affect the rest of the body. And a vaccine does this by the administration of either a dead virus or bacteria, or a live version that has actually been modified so that it can't fully replicate or it can't cause the full-blown disease that an unmodified bacteria or virus would do. So as a result, we'll often actually see mild side effects, which are just signs that the body is essentially fighting a mild infection. And I know personally that after I have a tetanus vaccine, my arm, it really aches for a couple of days and I feel pretty rough for the next 24, 48 hours. And that's pretty similar to what we can expect with our pets in some cases. So fever, lethargy, inappetence, so going off their food a little bit, weakness, stiffness, or even tenderness, and sometimes local swelling at the area of an injection and vaccination really is not all that uncommon, and that can absolutely manifest as shaking or trembling in some dogs. Now, these side effects, they are more common in younger animals, certainly in my experience, and most dogs actually don't get any kind of problem, or they'll just be a little bit quiet. And if a dog does experience these side effects, or a cat experiences these side effects, they typically resolve after about 24 to 48 hours. They just don't need any specific treatment, a bit of TLC at home, and they're soon right as rain. And remember, we've got to remember they're protected from potentially fatal disease. So we've got to get our priorities right from that point of view. Now, that's not to say that side effects or serious side effects are completely non-existent. There are risks of very rare but more serious side effects, and that can be an anaphylactic reaction. And that can result in breathing difficulties, collapse, and ultimately death. We can get vomiting and diarrhea. We can get generalized swelling, so of the face, of the neck. And we can also get something called injection site sarcomas, typically in cats. Now, they are very rare, but they are tumors that develop at the site of repeated injection. So they're not necessarily vaccine related. I think it was first thought that they were vaccine related, but they're injection site sarcomas. So it can be injections for other reasons. They cause these really nasty, aggressive tumors. So those are the serious side effects, but we don't want to overstress those because they are very uncommon. Now, for more mild side effects, a vet might give some anti-inflammatory medication at the time of vaccine if you know that your pet has had one of these side effects in the past. Obviously, if they've had a more serious side effect, so if they've been very unwell, if they've had a suspect anaphylactic reaction, if they're vomiting, diarrhea, if they've kind of collapsed, then we really need to be careful with giving follow-up vaccines. So there are different types of vaccination, but we also need to kind of weigh up the benefits against the risks to an individual. So if it's felt that there are going to be serious health risks as a result of vaccination, then we need to question, is it really essential in that individual? So moving on to question number 2, and this is all about sudden blindness in dogs. So this dog noticed that the eyesight was going maybe a week previously, and then the dog suddenly became blind. They took them to the vet where I was examined, and there was the suspicion that it's going through sudden acquired retinal degeneration syndrome, or SARDS. And the question is really, well, what are the causes of sudden blindness? Is that going to be the diagnosis? They've done some reading about HeartGuard. The dog has just started HeartGuard, and there's potentially some implications that can cause sudden blindness. And then are there any treatments that might actually help this dog regain their sight? So there are potentially a number of causes of sudden blindness in dogs. So the SARDS, or sudden acquired retinal degeneration syndrome, is certainly one, but we can also get cataracts due to diabetes. We can get retinal detachment, which can be an immune-mediated problem, so the body's immune system isn't working as it should do, or it can also be blood pressure related, which is generally a result of kidney disease. We can also have glaucoma, which is an increase in pressure within the eye causing blindness. That's often very painful and is can be quite obvious when it's advanced. And we can also get tumours in the eye that can cause blindness. And there's a whole heap of other things. We can get brain lesions as well. Now onto HeartGuard. Now, HeartGuard contains ivermectin, and ivermectin toxicity can cause sudden blindness, but at normal doses and even at 10 times the normal dose, so a 10 times overdose, HeartGuard has been found to be safe, even in collies, which is a breed that is known to be more sensitive to the effects of ivermectin than other breeds of dogs. So normal HeartGuard treatment, it's really highly unlikely to be responsible for this sudden blindness or for any blindness unless a really serious overdose was given or there was another exposure to a different source of ivermectin. So ivermectin is found in other parasite control products and also some livestock products and that kind of thing. So if there's been any exposure to those chemicals, then that's certainly a potential and one to bear in mind. Now, the sudden acquired retinal degeneration syndrome, that's actually a really rare disease. We don't know why it happens. It could be immune mediated. So again, the immune system isn't working properly. It could be due to something called Cushing's disease or hyperadrenocorticism, which is an abnormality in a body's either pituitary or adrenal gland. Blindness generally occurs in less than 1 month. So this dog certainly ticks that box. It's often accompanied by an increase in thirst and an increase in hunger. So that would be interesting to know if that was the case. And unfortunately, there's no medical or surgical treatment that we are aware of at this stage to treat that. Now, that could mean that a dog is blind permanently. But it's important to think that actually many dogs can cope very well with being blind. Some will struggle. And my experience is that those dogs that have become blind very, very suddenly, and certainly with something like diabetic cataracts, that can happen in 24 to 48 hours in some cases. So it can come on really suddenly, and that's in both eyes. And they may struggle to cope a little bit more. But those dogs that become blind maybe a little bit more slowly, they can cope very well, but we need to be keeping the environment stable. So we don't want to be moving furniture, changing the floor plan of the house just so that your dog kind of is very familiar with their surroundings. We want to install stair gates if you've got any stairs so that they can't either fall downstairs or they can't climb up and get themselves into trouble, and that can cause them some serious injuries. You can also get something called a halo harness when your dog is out. So that is a little harness that they wear, and it's got kind of almost like a plastic halo rim that goes around their face so that when they are coming up to bump into something, then that actually knocks into that halo. The dog feels it and they're not going to bump into it and hurt themselves. Talking to your dog is also important. Just don't sneak up on them because that can give them a fright and cause a great deal of anxiety. So while it can be very distressing, and understandably it's very distressing for any dog that goes blind suddenly, they often will cope very well with a few changes and a few adaptations to their lifestyle. So that's definitely something to consider. But remember that the information I give in these podcasts is not a substitute for a consultation and examination with your pet's veterinarian and should not be taken as specific advice for any individual pet. If your pet is unwell, if they're injured, or if they're suffering from any kind of problem or you have any concerns, then talking to your vet is always the best course of action.
Get your question answered at dralexanswers.com.
Question number 3 was sent in by an owner who had a really elderly dog who 3 years previously was diagnosed with serious kidney and liver problems, and they really just want want me to talk about the silent impact of kidney and liver disease and how they can actually be treated so well. So this is a 17-year-old dog who was doing very well for 3 whole years after being diagnosed with some potentially serious life-threatening diseases. So yeah, absolutely, kidney and liver disease problems, they're not uncommon in both elderly dogs and cats. They often sneak up slowly over time, and so it can actually be quite late when a diagnosis is reached. We're not necessarily picking up that they're unwell, that they're not feeling themselves, that their appetite might have reduced a little bit, their weight might have started to fall off, they might have started to drink a little bit more water, but they can all be quite subtle changes. And unless you're sitting there watching your dog or cat every day and measuring their water intake and constantly recording their weight, they're easy things to miss. And the liver and kidneys, they're crucial organs that affect every part of the body. So, that said, the most common signs, like I say, we get an increased thirst, an increase in urination. We can also get vomiting and diarrhea as things progress. We can get inappetence leading to anorexia, so they can start to become a little bit picky and then completely go off their food. We then move on to lethargy, to weakness. In the case of liver disease, we can get jaundice, so that's when their gums or the whites of the eyes become very yellow. It can then progress to seizures and coma, and ultimately these diseases are deadly if they're left untreated or if they progress to a certain level despite treatment. That being said, early treatment especially can carry an excellent prognosis. So if we can, with any of these problems, with these changes that we notice in our dog, if we can identify an underlying cause for them, then we're going to be in a much better position to treat them more effectively in the early stages. That can involve dietary management. It can involve techniques to maintain hydration, so getting your dog or cat to drink more water or changing them onto a wet diet. It can involve other supplementation, so especially with liver disease, there are a number of different supplements that we give to help reduce inflammation, to help reduce scarring, and to help support the liver function going forward. Other supplements might be, with kidney disease, it might be phosphate binders. So with dogs and cats with kidney disease, they tend to have really high blood phosphate levels, which can cause the disease to progress at a greater rate. So we want to try and reduce that. We also want to control other symptoms. So that can be nausea, it can be high blood pressure, it can be anemia. There's a number of other knock-on effects that these conditions have that we need to control. But if we're addressing things early, then we can actually have a really good outcome, and we can have or your pet can have an excellent quality of life and also increase their quantity of life. If we're, on the other hand, only diagnosing them late in the day when an animal is already having seizures, when they're completely anorexic, they're off their food, they've lost a whole load of weight, then unfortunately often the prognosis is a lot more grave, and often those patients won't recover as well as we would expect, or they won't recover at all despite our best efforts. So as with everything, if we get onto any changes, any problems early, we're going to be in a much better position to successfully treat our pets. And before we jump into the next question, I just want to let you know that this episode is brought to you by my other podcast, the Our Pets Health podcast. And that's the show that brings you pet health information to help you prevent disease, keep your pet healthy, or treat them to the best of your ability should they become injured or unwell. Just search for Our Pets Health in your favourite podcast app to start listening today.
You're listening to the Dr. Alex Answers Show.
Question number 4 was sent in by the owner of a little Chihuahua who is wondering, is it okay for their dog to sleep in their bed? Because this wee dog likes to snuggle up under the covers and curl up at the foot of their bed. And they're wondering if that's okay. Is that safe for the dog? Is it okay for them? So to start with, about half of all dog owners let their dog sleep on their bed. So you're definitely not alone in allowing this. And it actually may help you feel safe. It might help you feel a little bit more cozy, as well as reduce any anxiety that you might be feeling. But it has also definitely been shown that it does lead to a more disturbed sleep. And certainly from our point of view, chronic sleep deprivation, it can have significant health consequences. Depending on how you're managing your dog at the rest of the time, if they're spending every last minute with you, then that can actually potentially lead to separation anxiety. And, that's sleeping in the bed is pretty unlikely to be the only cause of this. But like I say, if your dog is spending every minute of the day with you and every minute of the night as well, then that can result in that separation anxiety because they're just not used to you leaving. They're not used to being left alone. They don't know how to entertain themselves, how to amuse themselves. So, that's something to consider. If your dog is just sleeping in your bed with you, but in the day, you're off at work, they're used to being left in the house by themselves, you're giving them chew toys, you're giving them food puzzles, that kind of thing, then, it's unlikely to cause any behavioural problems from your dog's point of view. And then the last comment really is just that for a small dog, certainly a little Chihuahua, you want to be careful that you don't roll over and crush them. Now, that might sound a little bit far-fetched, but it's certainly possible if they're sleeping right next to you and you're a heavy sleeper, you could roll on top of them, and that could cause them some serious issues and also potentially be fatal. Now, the chances of that happening are pretty remote, but it's just something to consider, especially if you've got a really small breed or a toy breed dog who is sleeping in your bed. And then finally, question number 5 is sent in from the owner of a cat who was attacked by a pit bull a week previously. No seemingly bad injuries, just had a toenail that was ripped, but then 3 days ago started to sneeze, started to have a runny nose, and had stuff in his eyes, so had a bit of a discharge from his eyes. Now, to start with, those signs of disease that are going on, they don't sound like a typical post-fight injury or any kind of problem that would happen as a result of being attacked by a pit bull. Obviously getting checked over by your vet is very important after any kind of trauma like that. Certainly dogs can do a huge amount of damage to cats, and I imagine that the cat was checked over, or at least I hope it was. Now, what these signs do sound typical of, though, is respiratory disease, so disease of the upper airway, so the nose, and really that can often be caused by stress. So stress can flare up often these viral diseases. So we have a couple of cat flu viruses, which are typical in cats and very common in that, called herpes virus, which is the same as what causes cold sores in us, or the same family of viruses that causes cold sores in humans. And also calicivirus is another one. And they can be present in a normal, healthy individual, and they will flare up at times of stress. Now, if it's only mild disease, then they can be fairly self-limiting, meaning that they will get better by themselves without any particular treatment. We need to keep the eyes clear. We need to try and remove any discharge from the nose. But very often as the stress dies away, so there's, if we can avoid any more fights, in this case, then, likely the disease will resolve itself. Now, we can sometimes, though, need other medications. So that might include something like lysine supplementation. It could be eye medication in case there's any ulcers developing. We can need antibiotics sometimes for any secondary infection. So sometimes the bacteria that are normally present in these areas will take advantage of the inflammation and damage that the viruses are causing, and need antibiotics to control those. We can also need to give warm, strong smelling food to make sure that our cats continue eating. A cat with a completely blocked nose often finds it hard to eat, or they don't have an appetite because they rely on their sense of smell so much for their appetite, and therefore they go off their food a little bit. Putting them in a steamy room can also help just to mobilize that mucus, any buildup that's happening in their nose, again, just to clear their nose. Now, if the disease is affecting a cat's general demeanour, or it's getting worse, or it's not going away, then obviously you need to consult with your vet, even if it's something that you've dealt with time again, if they've had a similar problem in the past. If they're getting worse, if it's not going away, then talking to your vet and getting them checked over to make sure that there aren't any other injuries or other diseases is going to be very important. So that's it for this episode of the podcast. Remember to head over to dralexanswers.com, where you'll find the links and downloads mentioned in today's show. Remember to subscribe, share this podcast with your pet-owning friends and family. And until next time, I'm Dr. Alex. Take care.
You've been listening to the Dr. Alex Answers podcast. Be sure to rate, review, subscribe, and we'll see you on the next episode of the show, where you ask the questions and Dr. Alex answers.